Good morning, good afternoon, good evening, everybody. Before starting my presentation, I would like to thank ASIASAFE, AOSR, and IAEA for inviting me to this webinar in order to share the Lebanese experience with regards to radiation protection of workers and patients in interventional procedures. So interventional procedures can be very complex because they involve prolonged use of fluoroscopy time and large number of images, therefore can result in high patient and staff doses. With regards to the patients, besides the stochastic effects, radiation-induced injuries to the patient have been associated with the interventional procedure. And with regards to the staff, it is well known that interventional cardiologists and radiologists have among the highest radiation exposure levels of all health professionals, especially their eye lens doses, with an increased frequency of lens opacities was identified in recent study. And during the optimization of radiation protection process, there are several important factors to consider. Among them are the X-ray equipment performance, monitoring of patient and operator radiation exposure, and radiation protection training of staff. And I will be dealing with those components during this presentation. Before starting, I want to give you a few numbers about the current practice in Lebanon with regards to interventional procedures performed on adult patients. Those are performed in mainly 64 hospitals with 10,000 to 15,000 interventional procedures per 1 million of inhabitants. And the majority are interventional cardiology procedures. Those are performed by 150 interventional radiologists, cardiologists, and 250 technologists and nurses. With regards to pediatric interventional procedures, we don't have any information about interventional radiology procedures. However, for interventional cardiology procedures, they are mainly performed in 3 specialized hospitals with 80 to 100 procedures per 1 million of inhabitants, and the frequency is low when compared to adult interventional procedure, and those are performed by 3 to 5 interventional cardiologists. So those are the objectives of my presentation. So for each component of the optimization program, I will give the IAEA GSR Part 3 requirements, and then an overview about the Lebanese situation, how we are fulfilling those requirements. And I will start by the quality assurance program. So the BSS requires radiology facilities to have a comprehensive program of quality assurance for medical exposures. This needs to be performed with the active participation of a medical physicist, radiological medical practitioners, and technologists. And also, the BSS requires licensees to ensure that regular and independent audits are made for the QA program. The aim of this QA program is to help to ensure successful implementation of optimization of protection and safety, and to minimize the occurrence of unintended and accidental medical exposure. And the QA program might include several components, among them measurement of the physical parameters of the X-ray equipment that needs to be performed by a medical physicist at the time of acceptance and commissioning of the equipment, periodically thereafter, and after any major maintenance procedure or any installation of new software or modification of existing software. And whenever one of the physical parameters are outside established tolerance limits, there should be implementation of corrective actions. And then we need to maintain records of the relevant procedures and results. So detailed guidance on the performance test and the quality control test that needs to be performed, including the recommended frequencies and tolerance limits, may be found in many published reports from international and national organizations, or may be specified by the regulatory authority. So I gave the GSR Part 3 requirements with regards to the QA program. And now I will be showing the Lebanese situation. So the licensees here in Lebanon are responsible for the establishment of quality assurance program for medical exposure, plus to ensure that internal audits are performed for such program. Imaging medical physicist is not yet legally required in radiology facility in Lebanon. Therefore, some QC tests are performed by the supplier, and the results of those QC tests are compared with the tolerance limits specified by the manufacturer. And the regulatory authority in Lebanon is responsible for making requirement on the tests that needs to be performed, their frequencies, and the tolerance limit. This is already performed, and the list is prepared, and we need to circulate it to the health facilities in Lebanon, and also to make requirement for an imaging medical physicist to perform the calibration, patient dosimetry, quality assurance, acceptance, and to be present during the commissioning of the X-ray equipment. And now I'll move to the second part of the presentation, dose monitoring and follow-up, and I will start by the patient. So the BSS requires licensee to ensure that patient dosimetry surveys be performed for the interventional procedure. And this means that to determine typical values or typical doses, and the results should be compared with the established national diagnostic reference levels. And please note that patient dosimetry, in order to determine typical values, needs to be done in conjunction with an assessment of the diagnostic image quality. And during the comparison, if the typical value of the facility is higher or substantially lower than the national diagnostic reference level, a review of optimization of protection and safety is needed. There are also specific considerations for interventional procedures, and the radiology facility should have a system in place for identifying patients who may be at risk of late radiation injuries. This need to be performed typically based on estimates of peak skin dose, cumulative air kerma or air kerma area product. And the ICRP recommends that patients with an estimated peak skin dose of 3 gray should be followed up. And also the IAEA established trigger level for patient follow-up in terms of peak skin dose of 3 gray, reference air kerma of 5 gray, and those area product of 500 gray per centimeter square. And for those identified patients, an investigation should be carried out as soon as possible following this trigger or event. And this investigation aims to improve the optimization of patient protections. Several actions needs to be performed. Firstly, calculation or estimation of patient dose that needs to be performed by a medical physicist. We need to record the calculation method and the result and place it in the patient medical file. Also, there should be some kind of notification of the event to the referring medical practitioner and to the patient, and counseling the patient when required, and implementation of corrective actions and feedback to the staff. And whenever changes are recommended, all staff should be involved in their implementation. Also, significant event should be reported to the regulatory authority, and the regulatory authority here needs to disseminate information on the event and the lessons learned to all the health facilities so that the recurrence of similar events can be minimized. Please note that there is some advantages in participation in international or national database, which aim to improve safety and safety culture in healthcare. And an example of such database is the IAEA SAFRAD reporting system. So those are, I finished with the requirement from the BSS, and now the current, the Lebanese situation. So licensees in Lebanon are responsible for patient radiation protection and safety. Interventional radiologists, cardiologists are responsible for patient dose traceability and safety. And the regulatory authority in Lebanon is responsible for making requirement for dose traceability. This is already done. For data pooling and establishment, updating of national diagnostic reference levels, we are in the phase of updating our national DRLs to set up alert levels for patient follow-up. Here we will adopt those from the IAEA, recommended by the IAEA, which I showed in the previous slide, and also to make requirement for a medical physicist to perform an optimization of the protocol used, and for patient dose calculation whenever an alert level is exceeded or an adverse effect is observed. And what we did till now in Lebanon is that we established national diagnostic reference levels for 27 types of interventional procedures. Also investigate the parameters that affects the radiation exposure during cerebral angiography and brain aneurysm embolization. Also, we established diagnostic reference level for pediatric interventional cardiology procedure. And we studied the parameter that affect the radiation exposure of pediatric patients who underwent percutaneous closure of ventricular septal defects. And with regards to the optimization, we established 2 simple steps for patient dose reduction in 3 health facilities. What we did is that we increased the inner infiltration from 0.2 and 0.3 to 0.6 millimeter copper, and we decreased the number of frames per second from 15 to 7.5 frames per second in fluoroscopy and acquisition modes. And we achieved a patient dose reduction as high as 54%. And for patient follow-up, what we did here is that we studied the correlation between the online dose indicators in terms of dose area product and cumulative air kerma with the peak skin dose measured using this sheet of thermoluminescent dosimeters in order to establish trigger level in 3 health facilities. Also, we benchmark the dose map software, which can calculate the peak skin dose with those measured using the same sheet of thermoluminescent dosimeter to check the accuracy of the calculated value of peak skin dose. And we established a strategy for patient follow-up whenever the peak skin dose exceeded 2 gray. And with regards to operator dose monitoring, the BSS established the requirement for individual monitoring for any worker who usually works in a controlled area or who occasionally works in a controlled area and may receive a significant dose from occupational exposure. Specifically for interventional procedures, it is advisable to use 1 dosimeter under the protective clothing and another dosimeter on an unshielded part of the body. And the reading from those 2 whole body dosimeters should be combined in order to estimate the effective dose. Also, monitoring of the hand or fingers and length of the eye should be considered, specifically for interventional procedures, because extremities and the eyes are particularly close to the radiation beam. Also, the BSS requires licensees to set up investigation level and the procedure that needs to be followed in the events that any such level is exceeded. So investigation levels are not dose constraint or dose limit, but they are tools used to provide a warning on the need to review procedures and performance and to investigate what is not working as expected and to take corrective actions. For example, some authors recommended that value higher than 0.5 millisievert per month for a dosimeter worn under the protective apron, and also values higher than 2 millisievert per month for an over apron dosimeter, and values higher than 15 millisievert per month for hand and fingers dosimeters could be investigated. And the investigation should be initiated as soon as possible following a trigger or an event. And the aim of this investigation is to improve the optimization of occupational protection. And by the end of this investigation, a written report needs to be prepared, including the cause, determination of the dose, corrective actions, and instruction and recommendation to avoid recurrence. And the regulatory authority may need to be informed in some cases. So I finished with the BSS requirements, and I'll move to the Lebanese situation. So licensees in Lebanon are responsible for the protection of workers and to ensure that protection and safety is optimized. Also to make arrangement for assessment and recording of occupational exposure and officially designate a radiation protection officer. Among the tasks of the RPO, he or she is responsible for operator monitoring and for declaring exposed personnel to the regulatory authority. And the regulatory authority in Lebanon is responsible for making requirement for monitoring, recording, and control of occupational exposures. This is already performed. Also, the regulatory authority in Lebanon reviews periodically reports on occupational exposure, verifies compliance with the requirement on the control of occupational exposure, and perform on-site investigation in case of high occupational exposures. And what we did till now is that we measured the effective dose, we estimated the effective dose and the extremity and eye-lens dose for 12 interventional cardiologists and 10 technologists from 10 different Lebanese hospitals. And we found out during this study that eye-lens dose for both the cardiologists and the technologists exceeded the 6 millisievert per year, and then therefore eye-lens monitoring is needed for the cardiologists and technologists. And also in a separate study, we assessed the accuracy of the evaluated personal dose equivalent. I am at the final part of my presentation, training and education of the staff. And the BSS placed great importance on education and training of all persons engaged in activities relevant to protection and safety. And the responsibilities lies on the government, the regulatory authority, and the licensees. And please note that the development and implementation of national strategy for education and training that is based on a national needs assessment can be very useful. So the BSS requires licensee to provide appropriate training and periodic retraining in protection and safety to ensure the necessary level of competence. So the training should include training on health risks due to the occupational exposure in normal and accident conditions. Also adequate instruction and training and periodic retraining in protection and safety, and adequate information on the significance of the actions of health professionals for the protection and safety. So usually the RPO is responsible for training their personnel on occupational radiation protection, and the medical physicist is responsible for training their personnel on patient radiation protection. So those are the requirements from the BSS, and here in Lebanon, the licensees are responsible to ensure that all the health professionals with responsibilities for protection and safety have appropriate education, training, qualification, and competence. With regards to the training on occupational radiation protection, this is performed by the radiation protection officer with initial and periodic refresher training with a new technique of evolution of X-ray technology and legal requirements. However, training on patient radiation protection is not performed due to the absence of imaging medical physicists. Therefore, this training needs to be done by the regulatory authority in Lebanon or by a certified body society. And the regulatory authority in Lebanon is responsible for providing training requirement, training frequency and content, and verifying compliance through regular inspections, and also to make requirement that a medical physicist or certified body society are responsible for training the personnel on patient radiation protection. And what we did till now is that we circulate a survey which include a question on occupational radiation protection and patient radiation protection in order to assess the awareness with regards to radiation protection among the Lebanese health professionals. And as a conclusion, from the three parts from this presentation, so as you can see from the conclusion of the three parts that I already discussed today, we are facing an issue with making requirements for a medical physicist in radiology because we don't have qualified person to perform this job in radiology. So what we are doing now as a regulatory authority, we are discussing the implementation of an academic program in medical physicists and also the clinical training with 3 Lebanese universities to have the clinically qualified medical physicists. And thank you for your attention.